And joining us in Spotlight this morning, Chief Executive Officer of the American Chamber of Commerce, Nirad Tiwari, to talk about how the government and the private sector should come together to get us some vaccines here in Trinidad and Tobago. Good morning to you, Mr. Tiwari.
Hey, good morning, Natalie. Good morning to your co-hosts and all your viewers.
And how are you doing this morning?
I'm fine, thank you. And you?
I am fantastic. Thank you so much for joining us. So, we have had a really interesting year plus since we had our first case recorded here in Trinidad and Tobago on the 12th of March. And now we're at the point where we're talking about getting vaccines. What do you think will be the best fit for that? Because realistically, the COVAX facility is just providing 20% of vaccines. How should we source the other 80% for the population?
So, first up, I think that the issue of vaccine acquisition and administration is the #1 issue facing Trinidad and Tobago at the moment. Because without it, we can't plan for whatever you want to call the new normal.
Yeah.
So all efforts should be focused on acquiring vaccines and ensuring that once we have them, the population is in a place to take them, not just that we can roll it out through the public health system and the private health system, but that people are ready and willing to take the vaccines. It's a very tricky situation at the moment, as we would all have realized, in that it's difficult to plan when you're not sure where supplies will come from. And I would prefer that we not look backward, but we look forward. I think it's fair to say that none of us expected to be in this position at the end of March, where we are, a dozen vaccinations ahead of Montserrat, but behind every other Caribbean country. The question now is, how do we move forward?
Do we, Nirad, blame the government for that? Should the government take responsibility for the fact that in the Caribbean islands, in the English-speaking Caribbean at least, we are behind the other Caribbean islands when it comes down to vaccination?
Well, you see, Natalie, I don't think blame at this point is going to solve anything, and it certainly has become very political, and that's not going to help us. We can recover. We should not have been in this position. I think we all would agree that we should not have been in this position, and we shouldn't still be in the position where, quite frankly, we're wondering when and how we're going to get vaccines and have them administered. The Ministry of Health has said that their goal is to vaccinate 1 million people by the end of 2021. And I think that we should focus on how we're going to get there. I think part of the challenge is the manner of communication. Given that we are here, more specificity would be helpful than less. So, saying that we're going to have 173,000 vaccines sometime in the near future without identifying where they're going to come from naturally would lead skeptics to say, well, we haven't gotten them yet. Why should we believe that we'll get them in the near future? And what does in the near future mean? But we can, the race isn't to see who vaccinates first. The race, in a sense, to the extent that there's a race, is to ensure that we have herd immunity as quickly as possible. And if we could get to 80% vaccinations, 80% of the population, or 75% of the population vaccinated by September, October, then that would be great. And that's really the challenge before us. How do we get there?
Nirad, I disagree with you to say we don't know where the 173 is coming from. I think they said a gift of 100,000 from Sinopharm, China, 40,000 from India, AstraZeneca vaccine, and the 30,000 through COVAX facility. But I do agree that we really don't know when they're going to get here. But when we
Well,
look at,
The Sinopharm vaccine is not yet WHO approved,
that's
and
correct.
they're varying studies on its efficacy. So I mean, WHO approval is not assured. The Sinopharm vaccine also requires 3 doses. So 100,000 is about 33,000 actual vaccinations. So
I
this
thought that
point for me.
I thought that there was a small group of people who required three doses. I didn't realize that was for everybody who took the Sinopharm vaccine. But apart from that, let's talk about the fact that we're talking about vaccines. And even right now in the English-speaking Caribbean, the only country that has gotten vaccine through COVAX is Jamaica. And the amount was dismal, 14,000 for a population of 3 million. Really and truly is nothing. So it seems as if at this moment for the Caribbean, it's going to come down to gifts. Donations, gifts, if you want to call them, of vaccines. So where do you think Trinidad and Tobago can go to source more of those? I know the Prime Minister had written to the United States asking for vaccines, and we see China and India have at least, decided or agreed to helping Trinidad and Tobago with some vaccines there.
So, as I said, we would prefer to look forward, and I do have some faith that the bilateral, what the Ministry of Health is calling the bilateral discussions with the vaccine manufacturers will bear fruit, and that we will be able to purchase some vaccines in the very near future, and certainly between now and September. I'm hoping that it's within the next month or two that we get some confirmation of orders and delivery so that we can add to our vaccine stock. But yes, as the developed countries vaccinate their populations and increase the rollout of their vaccinations, as well as more plants come on stream, more manufacturing capacity, there is the possibility that we may get some doses from some of our traditional partners and allies, such as the United States. But that is still to be seen. As you would have seen yesterday, the EU is considering some level of, they're not calling them outright export restrictions, but some formulae to allow for vaccines to move in the EU and then out of the EU. So we're still fighting that battle. And this is another example, though, of why solidarity of small states matters and how we need to craft our foreign policy in what foreign policy wonks call concentric circles, starting nationally, regionally, hemispherically, and moving outward. And you would remember, no doubt, that we have traditionally been part of the ACP bloc, the Africa, Caribbean, and Pacific bloc. And this is a time where leveraging that bloc might make a big difference in trying to get some form of vaccine equity and ensuring that facilities like the COVAX that were designed to do just that are in fact able to operate effectively. And you'd see the government has done that through the African Medical Union and so on. So
yeah,
that has to be part of our strategy as it has been going forward.
What is the role of the private sector? What's the role of the private sector in the acquisition of vaccines here in Trinidad and Tobago?
So I think that there are a few things. So the private sector has offered formally and privately to help with the communication around the need for people to take vaccines, as well as attempting to combat misinformation around vaccine efficacy, how well the vaccines will work and what the side effects really are, as opposed to what scaremongers might say that they are. That's one. The second is when we do get vaccines, assuming that there are periods where we get significant volumes, and because of cold storage and the requirements to get them into arms quickly, if there's a need for vaccine for additional sites or additional capacity, the private sector can help. Both companies that have doctors and registered nurses on staff, as well as the private medical institutions. And I know the Trinidad and Tobago Medical Association is also actively engaging the Ministry of Health on that, and that is a part of the private sector, of course. And then there's the issue of acquisition of vaccines. Obviously, the government has to be very, very careful that the people with whom they engage are legitimate and honest in terms of being able to acquire vaccines when they say that they are acquiring vaccines, and the process of procurement will have to be transparent, because you don't want someone trying to take advantage of the situation and therefore sell us vaccines at triple the price, say that it can be purchased at if the government were able to access it, or that our neighbors, say in Barbados or Guyana, would be able to access vaccines. But there may be private sector entities who, through historical relationships, who through planning, may have put in orders for vaccines and have access to those. If that turns out to be the case, and I say if, then we should ensure that we are able to facilitate the importation of those vaccines, so that we have vaccines coming in along multiple tracks. As you said, donations, vaccines that the government may be able to buy and procure through direct negotiations with suppliers, and then vaccines that the private sector may be able to purchase and provide. The government has said that if the private sector is able to access vaccines directly, that they will, at this point, allow the private sector to bring in the vaccines once they are WHO approved, and that 50% would have to go into the public health system.
Does the private sector, does AmCham support that position? That if the private sector brings in the vaccine, that 50% has to go into the public sector. Is that position supported among the community?
Well, I think that's what the government has stated, and as we said earlier in the week, what is required now is focusing on the primary goal, which is that we need to get to herd immunity, and therefore we need to get 75–80% of the population vaccinated, which means we have to get vaccines in country. Once we agree on that, then we can find ways to make it happen.
What about the fact that the government...
I don't want to speak for individual companies and what they may be willing to do.
No problem. What about the fact that the government isn't willing to give that tax write-off to those private entities who are bringing in vaccine? What does the AmCham then think about that?
So I think that referred to a specific case. And again, I don't... So my understanding is that, I don't want to avoid your question, Natalie, but I don't want to get...
You've been doing fantastic so far this morning.
My understanding is that there was a point where the private sector may have been thinking about supporting the government's acquisition of vaccines. So the government had an order that it wanted to fill and required payment to that supplier. And what the company involved, or what one offer was, is that yes, we will pay for it, but give us some tax credits next year. I think these are things to be discussed.
Yeah.
And I don't think that they are insurmountable. The government had said from very early on that the issue of the purchase of vaccines is something that had been catered for in the fiscal planning, and therefore I saw that there was a statement from the Minister of Finance this week saying that the government will handle that, and
but yet
maybe that issue
the government called the business community to the table to seek help. So what do you believe is the situation?
Trinidad and Tobago has the resources as a country, and the government as the entity, as the elected entity that has the authority to expend resources on behalf of the country, has access to the resources to purchase all of the vaccines we need, should those vaccines be available for purchase.
Narad, we do have to leave it there.
Pardon me?
We are out of time. Please, you were saying something?
I'm saying that if the government feels that it wants to engage the private sector and get some assistance, some partnership in doing that, I think the private sector has shown that they're willing to engage and to try and help once there's a process in place to do so, and we can work out the details of such going forward.
All right, Narad, thank you so much for speaking with us this morning.
My pleasure, as always.
Yes, Narad Tiwari there, the Chief Executive Officer of the American Chamber of Commerce. And he's saying that we do have the resources, the government has the resources to get the vaccine. We should not have been here in the first place. Seems as if we're lagging behind, but he believes in looking forward, and they're looking to get towards herd immunity, and the private sector is willing to help where it can to get us there. We take a break and we'll be back.